Thanks, Premier. Certainly, just to reinforce, outdoor activities are actually fine if you do them safely. We know that we focused on rule breakers yesterday, but I've seen many examples of people doing absolutely the right thing, enjoying the outdoors. We know it's good for emotional well-being, psychological well-being, so it's important to get out. But the rules are no more than 2 households coming together and no more than 5 people, or indeed your entire household as a collective, and keeping your distance from other groups. There are many examples of people who are outdoors, enjoying their time in those groups under 5 and keeping a distance from others and wearing masks. Yes, the risk of transmission outdoors is less, but the whole point about limiting the number of households that you can interact with is that they are new contacts for you. They are still opportunities for transmission of the virus. That can still happen before you develop symptoms. And so limiting it, wearing masks and being outdoors are all important ways to make sure that that transmission doesn't occur, but sticking to the rules is a really important part of that. But congratulations to all of Melbourne who've done that, and I do hope you enjoy the outdoors in a safe way. So there is another regional case in Mitchell Shire. It's linked to the Butchers Club outbreak. It is a point to note that regional Victoria will remain at risk while there are still essential workers who need to move into regional Victoria and the close contacts that occur by virtue of that. So we have to be mindful of that. We're all trying to protect regional Victoria from any new cases. But we have to remember that regional Victorians still need to get tested if they're symptomatic, and they still need to be mindful of the ways that they can protect themselves, and for Melburnians who are going there, again, by physically distancing and by wearing masks. And of course, if you're unwell, to not be working, not be going anywhere, but getting tested and staying at home until that result is through. The numbers are a bit high today. But the trend is still on track. I would say, we're seeing it in the hospitalised cases. We've only got 1 patient in ICU on a ventilator, only 3 in intensive care in total. I read a story from New York when it went through its March-April epidemic where, basically ENT specialists were running ICU patients because they were so overwhelmed. That's what we've avoided. We'll continue to avoid that, but that is what the potential is when cases get away from you. That's what Europe is probably facing in this second wave. They've got younger people being infected. They're less likely to require ICU, but the numbers now in second waves are sometimes orders of magnitude higher than they experienced in the first wave. So that will be a huge challenge for healthcare systems across the world as second waves start. So we need to be thankful for where we're at and to be mindful of the fact that we can keep it that way into the long term. That will be a struggle for many other countries around the world.
We're happy to take any questions you have.
I just ask Brett, on the Butchers Club outbreak, how many cases now are linked to that in total, and how's this Mitchell Shire one connected?
There are now 20 cases linked to the Butcher Club at Chadstone Shopping Centre. That's 6 staff, 8 family members or household members, and 2 customers of the Butcher Club, and there are 4 other contacts comprising customers and staff who are present at the centre but not as yet, and maybe not easily identified as a link to the Butchers Club, but our suspicion would be, again, that there is probably a link there. The fact that we've only got 12 cases and we're identifying people who were at Chadstone at this time who are testing positive obviously gives us suspicion that they're linked in some way. And it might be, again, super spreaders or super spreading events where someone is particularly infectious and there's only casual contact, or there's only shared facilities like the public toilets in Chadstone that might have contributed to this transmission. So it's a salient lesson. Workplaces, essential workplaces will continue. People who work closely together can be part of a cluster, and all of their household contacts then become the secondary cases, and then the tertiary cases are where some of those household contacts go to their essential workplaces, again, before potentially they're symptomatic. So, the settings that we have in place now are really important. this is what happens with these settings. You can imagine if every retail place was open, every business was open, and people could move freely between a significant number of households without restrictions.
Are all of today's cases that have been linked to outbreaks linked to the Butcher Club, or are there other outbreaks?
No, I think there are other outbreaks that they're linked to, but there are 3 linked to the Butcher Club and 3 linked to Electra Park Medical Centre in Ashwood.
And just on the total number of active cases, I think it's the same as it was yesterday, today, and it's the first time that it hasn't fallen since August 15. Are you at all worried about that fall that we've seen since August stagnating a little bit?
Yeah, absolutely. I mean, I think obviously it'll be reflective of the fact that there were only a dozen cases that have completed their infectious period and are now no longer considered cases, and we've got 12 new ones. But we need to drive it down. I think we'll get there. We've got days before us and days ahead of us that'll be lower than 12, so that number of active cases will come down. The activity in aged care continues to drop, especially for residents. But staff as well, slowly but surely reduced numbers of cases. I should say mystery cases or cases of unknown origin remain a concern. We've got an uptick in the total number in the 14-day rolling period. There are 3 new mystery cases that have been identified or classified as of today. They're not in today's numbers, but they're postcodes 3145, 3023 and 3019. And for those who are not postcode literate like myself, that's 3145 East Melbourne, Caulfield East, 3023 is Carolyn Springs and Deer Park, and 3019 is Braybrook, so to the southeast and west of Metro Melbourne.
Just on the Butchers Club, the cluster there, does it have anything to do with the protests that we saw at Chadstone Shopping Centre over the past few weeks?
Look, we can't say. I don't think so. I think the likelihood is, knowing that there's been a cluster of cases at the Butcher Club and in an adjacent cafe, Jasper Coffee, means that there were opportunities for transmission there, and most people then become symptomatic 5 or 6 days after being exposed. So I think that's the likely link and the likely timeline. It's clearly not helpful to have people gathering anywhere where there's that potential, and that's why we keep reinforcing. Doesn't matter what the gathering is for, if it's breaking the rules, whether it's a protest, whether it's just a gathering that's breaking the directions for other reasons. We just don't want it to happen because of that risk.
And have you got one of these local health teams overseeing contact tracing and everything at the Butchers Club?
Yeah, absolutely. We are, the individual cases that we see have great complexity to them sometimes, and we're standing up incident management teams or outbreak management teams for those individual cases. That's how much we're chasing this down, and it's because there are complex links and there are dozens of close contacts and dozens of networks that need to be explored in order to manage that.
So is that being done locally, just to be clear?
Yeah, it's being done locally. There's obviously the central case contact and outbreak management team that provides direction and support to that, but a lot of the community engagement testing is facilitated by a local incident management team.
And is it going well?
Yeah, it is going well. They are both aware of the issues at play locally. They know the stakeholders that they need to engage, and they are speaking to their community members and their representatives with that knowledge about what their needs are, what the messages should be, and how it should be transmitted.
One case today from the Butcher Club, a customer or a staff member?
So a household member.
And the 32 healthcare workers, are they? Do you have a breakdown of whether they're aged care workers or
the active cases?
Yeah.
17 aged care workers, 14 nursing staff, and 1 medical practitioner, which has kind of been the relative split right through. That there's an overwhelming majority that are aged care staff of whatever kind, and nursing staff making up the majority.
Do you have a breakdown of the 91 active cases in aged care?
Oh, you're just asking the tough questions, aren't you? No, I don't.
There's 3 active cases in regional Victoria. I assume on top of the Mitchell Shire one today, the other 2 are still Colac, Otway and East Gippsland?
Yes, East Gippsland and Mitchell Shire, as I understand it, the other 2.
How is it then able to justify the restrictions that remain in place in regional Victoria, given there's just 3 cases there?
So again, the settings that we have in regional Victoria really relate to what the transmission potential is if a new case were introduced there. If you have no restrictions, for example, and you know, it's not inconceivable that in the next week or 2, or a couple of weeks probably, that regional Victoria could have 1 or 2 active cases. But if the settings allow for dozens and dozens of interactions for anyone, then an infectious case has dozens and dozens of interactions, and that is what leads to that exponential growth in cases. Regional Victoria doesn't want to see that. None of us want to see that. So if we could absolutely isolate regional Victoria completely from Metro Melbourne, then maybe we could have settings that that really allow much more freedom of interaction. But while there's essential work, while there are those interactions with Metro Melbourne that must occur because of essential industries, then we have to have a kind of setting that minimises that potential. It doesn't take it away, as you've seen, but we have to minimise it.
Why can't individual regions be broken down the same way that Melbourne is broken down from everywhere?
For that same reason. People will move across regional Victoria for essential reasons, and in a sense, if you were to create a region with no restrictions, what do you think that might mean for people moving?
It's not about no restrictions, it's about the level of restrictions.
Or level of restrictions that are really appealing to people who haven't been able to do a number of things. You know, it might be indoor community sport. I can see that, you know, that could lead to people moving into those regions furtively to be able to enjoy some of that. Now that would be a risk to that region, just as they're enjoying it themselves. There would be a risk of seeding from other places that might have cases. So all of that needs to be kept in mind, I think.
The state of Victoria landmass size is 23 times the size of the Greater Melbourne region. Do you think it's justified to keep that entire region on the restrictions they are currently at when there are 3 active cases, albeit rather close to Melbourne?
Clearly we do. Like this is the setting that's been judged to protect regional Victoria, and lots of regional Victorians understand and desire that, and would not want it any other way. We know that it's tough for businesses. We know that it's tough for people who haven't been able to see family members and loved ones for a long period of time. But the alternative is to see a growth in numbers that just leads to greater restrictions. The judgments that are now being made about Victoria's border with South Australia and elsewhere are judgments that can only be made because we've got down to the number of active cases we have in regional Victoria. If that were to turn around, again, it's not for Victoria to make those decisions, but I can see other jurisdictions saying, well, that's not safe to open up with regional Victoria. So we need regional Victoria to be in a position where they can have that movement potentially across to other jurisdictions in Australia. WA has obviously made a judgment about not requiring a mandatory quarantine period in a hotel for Victoria. That's because of where we've gotten to.
There will be more movement around Melbourne this week with senior students going back. Any concerns around that, or are you comfortable?
Yeah, we're obviously moving slow and steady. The risk in primary school kids is less. We're really clear about that. As you get older, that risk transitions and you get to more adult-like transmission of illness, so we have to be aware of that, especially for year 11s and 12s. But overall, we just need to make sure that it's not just a case of back to normal at school, but all of those things that we've been working very closely with the Department of Education around, which is ventilation, making sure that anyone who's unwell, who has symptoms, doesn't come to school as teachers, as other staff or as students, that they're home getting tested, getting a result before they're coming back to school. All of the hand hygiene, all of the physical distancing to the extent that it can occur, and of course the masks for kids in senior school.
And do you think school, given what we saw at Altaqua College, the big outbreak linked to that, do you think schools understand what they need to be doing?
I think so. I think there's there's been lots of reflections from the early part of this wave, and in part the challenges at that point in time was that community transmission was increasing, and what the Murdoch Children's Research Institute research told us is that community transmission drives the cases in schools. It's not really the other way around. They don't necessarily amplify it. So we've gotten to a point where the levels of transmission in the community now are so low that makes schools really a very safe place to go. It does mean that you can still get a community case who turns up in school, but we've got really good program to minimise the risk of transmission within that school setting.
This might be one for the Premier, but where are we at on the return of years 7 to 10 in terms of working out what the timeline might be for that?
On the issue with opening pools is that it is an outdoor setting. They are 18, 20 times less risky in terms of transmission than indoor settings. We will get to pubs opening in a COVID-safe way at the right time, but there's a volume of people that would apply to, millions, this is about a small number of bookings within a 5k area that applies to other outdoor pools that we regard as safe, with COVID restrictions in place as well in terms of the caps on numbers and all of the other procedures they have to go through from a hygiene point of view.
Suburban contact tracing hubs, the Premier obviously indicated it'd be a permanent feature of our public health team in Victoria. What does that actually mean, and why is that a good thing?
Look, it's a really critical evolution. I've been an advocate for decentralised health protection or public health functions for a long time. The engagement with local partners is a really critical one. You understand what the issues are when you're connected to those local communities and the local community health centres and other stakeholders. The ability to understand that on-the-ground intelligence is much greater, and the agility and flexibility, as well as the surge capability, because you've got those in place ongoing, is much greater. It's an opportunity to build experience and to build the kind of credentials for public health that will be an asset right through. As the Premier said, they'll be COVID focused for a period of time. There's an opportunity to expand to all of our notifiable communicable diseases, of which there are 70 plus. And there's a potential opportunity to go to the broader issues of health protection, food safety, environmental health, that brings in Legionnaire's disease, foodborne outbreaks and the like. There's even an opportunity to have the most fulsome public health functions, which goes to population health, tobacco control, physical activity, obesity, whatever it might be. So I think we're designing with a COVID focus at the moment, but absolutely in mind to the full functions of health protection or public health down the track.
And why was there a need to expand it to have more than 5 suburban contact tracing hubs? I guess, how did you arrive to that decision over the last week or two?
Look, I think we're reflecting on getting a good coverage for metropolitan Melbourne. They're geographically housed with health services, but they're absolutely community focused, and they should and must be community health led, primary care led in terms of their operations. But the kind of health services clusters that have been a part of our COVID response is a nice way to get that geographic spread across Metro Melbourne. And from my point of view, I'm not going to argue against greater numbers than lesser numbers in terms of that surge capability and the opportunity for a public health and ID workforce to be able to engage in all of that work and learn over time.
And as part of your internal modelling, as we go towards COVID normal, enter the later stages of summer where the weather gets hot, have you been inputting data into your softwares that reflects the crowds we saw over the last few days?
Certainly the policy settings are put in as assumptions into all of that modelling. There is a consideration about what levels of compliance happen with those settings, and with an understanding that it won't be the same week on week over time. So yes, that's accounted for. That they're pretty difficult predictions to make. You make assumptions on a best guess, but you also try and follow what you know from the data over time, because we do have that data around people's self-reported compliance, willingness to comply, motivation to comply. So all of those things are inputted appropriately.
And when you do input those crowds and the assumptions, does that reveal anything different in regards to our roadmap and whether we can achieve COVID normal by the end of the year?
Oh, it's certainly given us those thresholds and those timelines. So yes, that's what the modelling is telling us. Alan's spoken to the fact that it's very fragile in the sense that a significant outbreak, when you get down to the last 20, 30, 50 cases, it's all dependent on who those 50 people are and how they're behaving and what their connections are. So the modelling can only tell you a kind of map on the path, but it can't tell you exactly what it'll look like when you get there.
Can I ask how you think we get from 11.9 down to 5 in 2 weeks?
Look, we have to see how it pans out. Obviously, some of the numbers on a daily basis have clearly been driven by our existing clusters and outbreaks. If we can get really good control of those in the next few days, limit further close contacts, and make sure that everyone who's a close contact is quarantined and safe, then those numbers come off our future daily numbers. So instead of 12, and with 6 linked to outbreaks and clusters today, we should see 6. And even those 6 are being driven down as there's more and more control in our aged care settings. And look, there are 48 active aged care outbreaks, so there's potential there for lots of new cases. But the fact that we're only seeing a couple a day out of those settings means that there's more and more control across all of those settings. A lot of them are coming to the end of their active period where they're closed off, and there's no longer a risk of further transmission.
You mentioned 3 new unknown cases in recent days. How concerned are you about that? And will they just have dropped off when we get to October the 19th?
That's right. So the 14-day rolling period, when we get to October 19, we'll go back to the 14 days prior. So that's starting in the next couple of days. But those mystery cases are always a concern. They may, one single case of unknown acquisition, we don't know what it represents, but it might represent 5 true cases out there. It might represent 10 or 15 true cases out there, because we don't know where they got it from. It means that there's someone else out there who's given it to them, and potentially given it to others who have very mild illness or asymptomatic, or who haven't presented for care or for testing. So we're focused on it, and the reason I listed those postcodes is it's really a call to arms for anyone in those postcodes. Of course it applies across Victoria, but anyone in those postcodes should be aware that there's transmission in those postcodes. They should really think about whether they're symptomatic and get tested to protect themselves with early diagnosis and management, and protect their loved ones and their families.
On aged care, you've described what we know about the aged care settings at the moment. Would you describe the way the cases are moving there as under control, given what we know?
Yeah, they're under control. Again, there's a fragility there because every single new case needs to be doing the right thing, testing as soon as they've got symptoms, and isolating if they're working in those settings. There's a real awareness now for everyone who's working in an active outbreak to look out for residents who present newly with symptoms, and of course for any of those staff members who develop symptoms to be isolating testing. So that's happening, and that gives you a much greater sense of control, but it's fragile. If someone develops symptoms, but they've been working, they've seen a lot of residents, they've had interactions with other staff members, and potentially, without those safe behaviours of wearing masks and physically distancing over the lunch breaks or tea breaks, that's a risk of spreading it to a number of staff. That's what happened earlier on in this phase. But there's really good control in a lot of settings now. But it only takes a delayed diagnosis, working with very mild symptoms for a few days, for that to mean 10, 15, 20 cases pop up in a day.
Once we start accepting return travellers again and we restart that hotel quarantine program, what kind of a role are you expecting and also hoping to play in that reset?
Well, I'll always be engaged in the sense that the hotel quarantine programs, working with Alfred Health around the infection prevention and control and PPE standards that apply in those settings, but anything that's required from my public health team in terms of expert advice and the risk management, and there are national conversations around best practice quarantine programs. We'll continue to look at what the future means for hotel quarantine, whether there's a risk stratification, whether there are any tweaks that we can make around that. Clearly there are some countries where there's such high prevalence of COVID that you've got a 5% or more chance of developing illness in hotel quarantine. There are other places like Western Pacific nations where there haven't been reported cases at all. They're probably COVID free, so we can potentially manage them differently.
The inquiry heard that you didn't play as much of an active role as you also would have hoped. I guess, are you hoping would you provide proactive feedback or proactive advice as opposed to waiting to...
I'm not waiting. I'm embedded, intrinsically looped in now. So I'm on the state control team with all of the secretaries of our major departments involved in this response. We discuss this through that state control team meeting on a daily basis.
Today, I think is when Victorians can no longer wear face shields; they have to wear masks. Can you explain why that's coming into?
So face shields basically protect the eyes, but they stop at about the chin level. There's an open space you can breathe in through your nose and mouth, so they don't provide protection from transmission other than that eye protection. So in addition to wearing a mask, they've been used in hospital settings, they've been used in other settings to give an added level of protection by protecting the mucosa of the eyes. But as protection alone, without a mask, they don't do the job. So we're basically saying you have to wear something fitting that covers the nose and mouth. That's what the standard required is, because we know that that's really what's needed to protect from transmission.
Just a quick one from Premier. Or you guys?
Just checking with the face shields, is that today that comes in? I thought it was another week.
I thought it was 2 weeks.
I thought it was 2 weeks.
I think it's 2